I'm continuing my talk here with Dr. Bark, and finally I would just like to ask, as a physician, knowing the doctors that you know, do doctors really believe everything is fine, or do they privately acknowledge that medical decisions, including what vaccinations are given, are being dictated by the companies making a profit from them?
That's a good question, and I don't know the answer other than there are certainly doctors who I see their belief in medicine, in modern medicine and the pharmaceutical industry as a religion, because they take things at face value. And I talk to enough doctors to know that they'll say things adamantly. And then when I question them, they actually don't know the research. They don't understand how the drug works. And I'll point that out to them. And they'll, when I tell them that there is this level of corruption, they actually, a lot of doctors are very clueless about that. Now, there's plenty of doctors who are sharp, who see the corruption, who get it. But I would say a lot of people go into medicine because they want a nice, steady, consistent job. They don't want to have to think too much. The practice of medicine is a practice, right? If you're a clinician and you have a busy clinic, and especially if you specialize, it's a lot of reflex behavior on the part of the doctor. You have this, you get this drug. You have this, you get this drug. You have this, oh, you have this, it doesn't follow that flow chart, so we'll do this instead. Now, of course, there's creative doctors and there's doctors who think. But you don't have to think to be a doctor. You don't have to analyze and have critical thought. And no, I mean that really seriously. You don't have to have critical thought. You have to have a very good memory in order to pass medical school and the boards, but you don't have to have much in the way of critical thought. And a lot of doctors don't have critical thought. They order a lot of tests for anything that comes their way. They can't discern what's going on, and they don't want to know what's going on in terms of corruption with drug companies and studies, because if they knew, they would have to do something to change the way they practice, or they'd be ego dystonic, right? They would be like, oh, I can't continue to practice this way because it's wrong. And if they admit that, that means they have to make changes. And there's just a lot of people who can't change. They can't make changes. It's too disruptive. It's too stressful. For them, change is scary and it's just too much work. I've literally had doctors tell me, I don't want to know. I don't want to know the whole thing about the vaccines because if I knew, I'd have to change the way I practice, and I don't want to do that. I've had other doctors tell me, I know there's problems, but I don't have the time to get involved. So those are the people that don't connect how you eat is how affects how you feel. They don't believe that what you put in your body affects you, except unless it's a patented pharmaceutical drug, then they believe in it. So there's a lot of disconnection going on, but people in our society are disconnected. I think doctors, probably represent the same amount of disconnection as somebody who's in the corporate world. I think in order to work in large corporate entities, where anything that big loses its moral compass, you have to be disconnected. You have to be, or you'd be ego dystonic. You would have a problem with how you behave in the world, that you're contributing to problems. I don't think anyone consciously wants to contribute to problems, but they can remain unconscious because if they're not, they'd have to change how they practice, and they don't want to have to do it. So I think, like any other field, especially in the groups of people who like comfort and maybe don't want to be too analytical and think out of the box, so it might be even a higher percentage, we're going to have a lot of doctors who don't want to know, they don't want to know, and then you're going to have the radicals who went in because they wanted to change the world and help the world, and they know, and they're very frustrated with the system, and they think the system sucks. But those are the more radical types of personalities in medicine, and they're not as common. And I think that maybe you tend to see them more in certain places than others, and in certain practices than others, but they're certainly not the cushy specialists, I can tell you that much. They're more, the primary care, and they're maybe at the county hospitals, and they know there's problems. I mean, there's plenty of doctors who get that the pharmaceutical industry is really who's footing all the bill for research at institutions these days. It's not the government like it used to be 30 years ago. Yes, there are NIH grants, and there are, less and less available, and it's drug company money that funds departments. And if you don't produce what they want you to produce, you don't get funded. So, it's a problem. We have a big problem. We have a big problem in our system. It's bad, and it's leading to the illness, the chronic illness. We're colluding. The industry is colluding. Doctors and hospitals are colluding with the industry and the chemical industry and the food industry to create constant and long-term patients.